Welcome to my channel. Don't forget to like and subscribe. Thank you.
Leukemia is a type of cancer that affects the blood and bone marrow, the tissue that produces blood cells. It primarily involves white blood cells, but it can also affect red blood cells and platelets. Leukemia occurs when the DNA of immature blood cells, especially white blood cells, undergoes mutations. These mutations cause the cells to divide rapidly and uncontrollably, eventually crowding out normal blood cells and impairing the body's ability to fight infection, transport oxygen, and stop bleeding. Types of leukemia. Leukemia is categorized into four main types. First, acute lymphoblastic leukemia, or ALL. It's most common in children, but it can affect adults too. It progresses rapidly and involves lymphoid cells, which are a type of white blood cell. Treatment usually includes chemotherapy and radiation therapy. Second, acute myeloid leukemia, or AML. This type affects both children and adults, but it's more common in adults. It develops from myeloid cells, which help produce red blood cells, platelets, and certain types of white blood cells. AML progresses quickly and requires immediate treatment. Third, chronic lymphocytic leukemia, or CLL. This typically affects older adults. It progresses slowly and involves lymphoid cells. Some patients may not need treatment immediately and can be monitored until symptoms worsen. Lastly, chronic myeloid leukemia, or CML. This type occurs mostly in adults and involves myeloid cells. It has a slow progression in its early stages but can turn aggressive if untreated. It's often associated with a specific genetic abnormality known as the Philadelphia chromosome. Symptoms of leukemia can vary, but common signs include fatigue and weakness, frequent infections, easy bruising or bleeding, and unexplained weight loss. Other symptoms include swollen lymph nodes, spleen or liver, fever or chills, bone or joint pain, night sweats, and shortness of breath. Causes and risk factors. The exact cause of leukemia is unknown, but several factors increase the risk. Genetic predispositions, such as inherited genetic mutations, can increase the risk. Radiation exposure, especially high levels from radiation therapy or nuclear accidents, also heightens the risk. Chemical exposure, like prolonged contact with benzene found in tobacco smoke in industrial settings, can elevate the risk. Previous cancer treatment, including chemotherapy and radiation therapy for other cancers, can increase the likelihood of developing leukemia later in life. A family history of leukemia raises the risk as well. Additionally, certain genetic disorders such as Down syndrome are associated with an increased risk. Leukemia is diagnosed through several important methods. First, blood tests such as complete blood counts are used to detect abnormal white blood cell levels. Next, a bone marrow biopsy is performed, where a sample is taken from the bone marrow to determine the presence of leukemia cells. Additionally, cytogenetic tests are used to analyze chromosomes in leukemia cells. Finally, imaging tests like CT scans, MRIs, or X-rays may be used to assess the spread of the disease. Treatment options for leukemia are varied and often depend on the type and stage of the disease. Let's go through them one by one. First, there's chemotherapy. This is the primary treatment for most types of leukemia. It uses powerful drugs to kill cancer cells or stop them from dividing. Next, we have targeted therapy. Drugs like tyrosine kinase inhibitors, or TKIs, are used for some types of leukemia, such as chronic myeloid leukemia, or CML, to target specific proteins that help cancer cells grow. Radiation therapy is another option. High-energy radiation is used to destroy leukemia cells or shrink enlarged organs. Then, there's immunotherapy. This treatment boosts the body's immune system to fight leukemia cells. For example, CAR T-cell therapy involves modifying a patient's immune cells to better target leukemia. Bone marrow or stem cell transplant is another critical treatment. This procedure replaces diseased bone marrow with healthy cells, often following high-dose chemotherapy. And finally, in rare cases, surgery may be performed to remove the spleen if it becomes enlarged due to leukemia. While leukemia often cannot be prevented, there are some measures that can help reduce the risk. First, avoid exposure to radiation and chemicals. Limiting exposure to high levels of radiation and harmful chemicals like benzene is crucial. No smoking. Tobacco smoke contains harmful chemicals that can contribute to the development of leukemia. Maintaining a healthy lifestyle is also important. A diet rich in fruits, vegetables, and whole grains, along with regular physical activity, can strengthen the immune system and reduce cancer risk in general. Regular medical checkups are essential. Those with a family history of leukemia or exposure to known risk factors should have regular checkups to detect any abnormalities early. Lastly, genetic counseling. For those with a family history of leukemia or known genetic risk factors, genetic counseling may help assess and manage the risk. The prognosis for leukemia varies based on the type, age, overall health, and how early it is detected. Acute forms like acute lymphoblastic leukemia, or AL, and acute myeloid leukemia, or AML, typically require more immediate treatment due to their rapid progression. On the other hand, chronic forms like chronic lymphocytic leukemia, or CLL, and chronic myeloid leukemia, or CML, may allow for more conservative management in the early stages. Advances in treatments, such as targeted therapies and immunotherapy, have significantly improved outcomes, especially for chronic leukemia. In conclusion, leukemia is a complex disease with a wide range of types, symptoms, and treatment options. While there is no guaranteed way to prevent it, managing risk factors and staying vigilant about symptoms can improve early detection and outcomes. Thank you for watching. Be sure to check out our other videos related to boosting your immune system and overall well-being.